Endoscopic cardiac surgery implies an operation for the heart. It still constitutes open heart surgery, but it's done using very small incisions, about 2.5 centimeters. This is about this big, very small, and using a camera, an endoscope, to show the object of the operation, in this case, the heart. Endoscopic cardiac surgery is applicable to 90% plus of all cardiac surgery problems. If we start by valvular disease, which are the valves inside of the heart, whether they are leaky or too tight, patients with atrial fibrillation can also be treated endoscopically. For those who have tumors of the heart, the endoscope is also a great tool to see in its full extent the tumor, the base of the tumor, and allow for the resection of such tumor. Not cutting the breastbone is not the only part that allows or facilitates a faster recovery in a patient. It is the fact that when we go endoscopically through the right side of the chest, we don't spread the ribs with a retractor. We only use a soft tissue, elastic rib port. And so without the spreading of the ribs, we're able to wake up patients in this same operating room and get their breathing tube out before they leave the operating room. There is ample data in the medical literature to support that minimally invasive techniques, including endoscopic cardiac surgery, improve the need for transfusions of patients after open heart surgery, as well as a postoperative pain, and therefore creating the circumstances to have a shorter length of stay, a shorter ICU length of stay, and of course, diminishing the time on the respirator. This type of surgery is indeed safe for the vast majority of patients. One can never say all because that does not exist in medicine, but in the case of endoscopic cardiac surgery, both young and very old patients, higher in age, 84, 85, 86, we have operated on such patients. And the advantage that it brings is that the absence of the sternotomy or breaking the bone allows these patients to get back to life sooner with less complications of both the bones or the lungs. Endoscopic cardiac surgery, as we performed it here in St. Elizabeth in Edgewood, Kentucky, is unique in that the biggest incision that we make is meant to fit the devices that we're going to implant. That is, the valve that we will implant or the prosthesis that we need to implant. The incisions do not need to be bigger than that because we don't need to see through the incision the object, the heart. We see that in high definition through a camera. We can see it even in 3D. In general, for patients that need open heart surgery, as an example, valvular disease, mitral disease, tricuspid disease, or aortic disease, as a consumer of healthcare or as a prospective patient, my first inclination would be to seek out centers and surgeons that perform minimally invasive heart surgery, ideally endoscopic heart surgery, because it's even less invasive, and that do it well. The questions I would ask the surgeon are, how many have you done successfully? What is your mortality rate? What is your complication rate? What is the rate of stroke? These are all very important questions that we need to learn to ask to really know more about, so to speak, the Carfax of not only the surgeon, but the center.